because you raised two issues that are hopefully fodder for some discussion. And one is the disruptive changes, and the other is the political debate. And so the end-of-life discussions are never comfortable. But we know that some enormous number, I've seen numbers in the order of 75 to 80% of all the healthcare dollars you will ever spend are spent in the last year of your life. What changes do you think are possible, Jonathan, to, if you will, reorganize the health delivery system to move people from acute care facilities like hospitals to appropriate care facilities? And I don't know what they are, but hospice comes to mind. Is there hope on the horizon for dealing with those kind of costs, end-of-life costs?
Oh, I think there is. So again, the political debate. You guys remember the death panels? Remember hearing about the death panels and how, this is what happens when government intervenes in healthcare. Well, what that was really about was, should Medicare, which is of course the largest payer, right? The federal government is already the largest payer for healthcare in America, but should Medicare pay for a physician to counsel a patient with a terminal illness about alternatives? In other words, continuing aggressive therapeutic intervention where you get chemotherapy and support in the intensive care unit against all odds. Maybe. Or if an informed patient with his or her family understands the state of their disease, the likelihood of survival, is there a point where palliative care, as opposed to interventional therapeutic care, is an appropriate alternative? And by the way, an advertisement, San Diego Hospice is a world leader in palliative care. They started off as hospice, they expanded comfort care, supportive care. Around the world, people come there. And a Robert Wood Johnson study took a look at patients who were at the latter stages of their life and their families, and assessed what the informed patient and family would prefer. And here are the two choices. You talked about alternate levels. Dying in home or aggressive treatment until the moment of death. I've made it a bit more extreme than it needs to be, but an informed patient, what would you want for your last days, given a pretty horrible circumstance, right? You have something for which modern medicine and ancient medicine offers no evidence-based cure or prolongation of your life. It turns out that informed Americans would much prefer to have comfort in an environment that they're familiar with, their home, or at least less interventional, like a hospice, than is actually occurring. And that really gets into a discussion I'll just mention and we can come back to. Who decides? Does the specialist decide what you should have happen, or should an informed patient and family collaborate and make the best decision for the patient, right? But so there are programs, I guarantee, I don't even know what it is, but I know that John and his group have it. We have it where that's exactly what we try to do, is find folks who appear to be heading down a terminal course and asking them what they want, providing alternatives that give them the comfort and support. Doesn't mean leaving someone alone. It's keeping them pain-free, keeping them comfortable, supporting them with what palliative needs are appropriate for them. If that was done, enormous, enormous cost savings.
Tom?
Yeah.